The symptoms of arterial disease fall along a very broad spectrum. For the most part, the severity of the disease correlates well with the severity of the symptoms. Walking, pain in the buttocks, pain in the thighs, pain in the calves and the feet. This is called claudication or effort-induced symptoms. But as the disease progresses, as arterial disease starts to limit the blood flow to the legs, further plaque buildup, further calcium buildup in the arteries to the legs, blood flow decreases, and this will lead to progressive symptoms. The symptoms are no longer present just with walking, they're present at rest. This is what we call ischemic pain or resting type pain. If it progresses further, patients may experience ulcers in their feet and their toes, skin breakdown, non-healing wounds, potentially infections or osteomyelitis. It's these type symptoms of arterial disease, the resting pain and the wound formation, that confer the diagnosis of CLI. So we have well-known risk factors for the development of arterial disease, and that includes CLI. For instance, age alone is a risk factor. We know that about 20% of individuals who are over the age of 65, men and women alike, who are otherwise healthy, have some element of arterial disease. Beyond that, the most significant risk factors that we know of are diabetes and smoking. These situations at least triple the chances that someone with underlying arterial disease will progress to CLI. If a person goes to their doctor and establishes a diagnosis of CLI, about 30% of those people within the next 12 months will experience an amputation. The absolute best offense we know is a good defense, okay? So preventive measures are beyond anything the best way to go. Interventional radiology can absolutely treat with more aggressive strategies, particularly in the case of critical limb ischemia. Some patients who have critical limb ischemia are no longer patients who would be eligible for any traditional bypass procedures. For any procedure with arterial disease, whether it's a traditional bypass procedure with surgery or an endovascular procedure, the goal is the same. We're looking to improve or restore blood flow to the extremity. So interventional radiology, with an extension of an angiogram, can offer the treatments to these patients. So we're able to, through the use of very minimally invasive procedures, just a small incision, can insert small catheters into the arteries themselves and direct those catheters right to the point of the disease that we're trying to treat. We're able to deliver special devices, special wires, special balloons, and other special devices in order to open up those blood vessels and restore flow. In some cases, we have devices that can actually decrease or debulk the amount of calcium or plaque that's in the artery to restore the flow. So most of the procedures that are offered with interventional radiology are performed through the arteries of the upper leg. But with the advancement of our technologies and kind of a better grasp of the techniques, we're actually now able to access the arteries of the foot, the very small vessels of the foot and the ankle, so that we can reach places that we've never reached before and able to treat these patients.
Leading radiology excellence through personalized and compassionate care. Greensboro Radiology. For more information, call 336-274-6682 or visit greensbororadiology.com.